Hello, guys. This is Dr. Rene. Guess what? I'm so excited. This week, I have one student who passed NCLEX with 75 questions. Nurse, I think a nurse spirit. She passed NCLEX just like that. I give you the name. Now, if you wanna pass NCLEX like her, don't let anybody fool you. Stop being frustrated, guys. Dr. Rene is the solution of your problem. Now, the reason why I'm different from all the other instructors out there, all of them, they are nurses. They are nurses. They have bachelor, masters, whatever the degree they have. They're all nurses. But not only Dr. Rene is a nurse, I'm also a doctor, the real doctor. I have a doctorate in medicine. So now, guys, the knowledge is a plus. There is no challenge for Dr. Rene when he comes to nursing content. Now, if you want a full review, you speak any language out there. Because Dr. Rene, the good thing about him, that makes me different. I speak different language. Wow. I speak Creole, Haitian, come on. I speak Spanish, Latinos, and I speak, of course, English. So I do teach in different language, guys. There is no excuses. Don't let people jump. Oh, guys, I can have. Don't let people fool you. Don't let people try to say they have a webinar, they have this online. This is real Dr. Rene talking to you. Not videos, not audios. I speak now with you. You see me. I teach you with tactic. And I'm doing this little video every week, guys. I post them. Now, before I start, I'm going to be talking tonight about sodium. I'm going to talk about mostly the most tested electrolyte is hyponatremia. I'm going to give you some tip of hyponatremia tonight. Then I'll be done. Now listen, if you need a full review, call me at 561-319-4660. If you friend, if you any family or anybody who knows me, this is Dr. Rene. So I'm from, so guys, I have different language. So I study medicine, I study nursing, I have my license in nursing also. So I have a doctorate in medicine. So now, if you want a review, you want to pass NCLEX, don't wait. Call me now at 561-319-4660. Now, let me talk about a little bit about hyponatremia tonight. What should you know about hyponatremia? What is the keyword? Now, the very first thing you need to know, what is hyponatremia and what is the normal range of sodium? Whenever sodium is sick, whenever sodium is abnormal, and the question is the abnormality is called natremia problem. So what? Let me say it again. Listen, guys, when you study a topic, the very first thing you need to know the definition. You need to know about the definition of the topic. If you don't know the definition of the topic, you won't be able to talk about it. Now, hyponatremia mean low. Hypo mean low. Natremia means sodium abnormality. The normal range of sodium, that's the first thing. 135 to 145. Now, if it's less than 135, it's hyponatremia. That's the one I'm going to be talking tonight. Now, when it's high, for example, it's hypernatremia. But the most tested is hyponatremia, because when you are hyponatremic, that means you have fluid imbalance. You have fluid overload. You have fluid retention. Now, hyponatremia is the opposite. Dehydration. Now, let me talk about hyponatremia. Now, hyponatremia occurs when you have an abnormality of sodium low. Now, less than 135 is hyponatremia. Now, the question is, what are the causes of hyponatremia? The very first cause of hyponatremia is a kidney or a chronic or acute kidney failure. That's going to cause that. ADH can cause that. Heart failure can cause that. Edema can cause that. Drinking too much fluid every day, drinking fluid over and over, can cause hyponatremia for NCLEX. Now, Hyponatremia, as a nurse, if they ask you the first question, what should you do as a nurse? What should you monitor as a nurse if patient is hyponatremic? You always monitor fluid status or fluid imbalance. That's the first question. What should you ask? What should you assess? Now, the next thing you need to know as a nurse, what is your nursing diagnosis? Your nursing diagnosis, second question, is fluid overload or fluid retention. Now, the next thing, beside of the cause and the nursing diagnosis, what should you monitor your client for? The next thing, you need to know the sign symptom. When patient is having too much fluid, what can happen? If you have too much fluid, it's like you're cooking and you put too much of fluid in the food. The food would not would not be salty. Would be without salt. So I mean, when you put too much fluid, that means there's no salt. So too much fluid means hyponatremia. Too much fluid means sodium is having problem. Now, as a nurse, the sign symptom of hyponatremia is the very first, too much fluid. Too much fluid. Edema, swelling. All those are symptoms. If you have too much fluid, you're gonna have edema, swelling. Now you may have water problem, intoxication, nausea, vomiting, too much fluid. Go all the way to your brain. Take from your brain to your feet, to your leg. You're gonna have meningitis problem. You're gonna have convulsion. You're gonna have confusion. You're gonna have seizure. Start from your brain. So now, if you start from your brain, you're gonna know the sign symptom of too much fluid in your body. So that means you're gonna have seizure. You're gonna have convulsion. You're gonna have ICP problem. So now your ICP gonna be elevated. Too much fluid go to the brain. That's why you're gonna have meningitis. Now, muscle weakness, of course. Now, muscle cramp, yes, when you have too much fluid, hyponatremia, you're gonna have muscle weakness or muscle cramp. Now, what else you're gonna have? You're gonna have lethargy. And one of the other problems you may have as a nurse when you have hyponatremia, you may find hyponatremia in SI-ADH patient, like I mentioned earlier. SI-ADH, too much ADH, too much anti-diuretic hormone, diuretic problem. Now, what happened to your potassium? That's another question now. Does your potassium increase or lower? That's an Nclex deep question. You're going to have too much potassium, the fact that you have too little sodium. Pay attention to this one. Now, the next question is, what are the following risk factors of hyponatremia? That's a question right there. Hyponatremia risk factors. The very first risk factor you need to pay attention to as an Nclex tip is lung cancer. When you have lung cancer, you have too much fluid, guys. When you have lung cancer or small carcinoma, that's hyponatremia problem. Pneumonia, that's another one. Seizure, that's another one. SIDS, that's another one. When you have, for example, meningitis is another risk factors. That's another risk factor that can cause hyponatremia. I mentioned heart failure, congestive heart failure. All those are risk factors of hyponatremia problem. Now, the question is, as a nurse, what should you do? Fluid restriction is your answer, Nclex. Do not give more fluid. Put your patient on fluid restriction. Put an alert at the bedside, at the door. Don't give fluid to your patient. And you need to make sure you remove this fluid by giving what an Nclex. You should give furosemide, hydrochlorothiazide, bumetanide. Those are loop diuretic. Those are part you need to give them. Now, when you give them, always check for potassium level. That's the question. Loop diuretic to remove those fluid, guys. Furosemide. Hydrochlorothiazide is a question. Hydro. Remember that hydro means water. Chlorothiazide. This is what you should know as a nurse for hyponatremia problem. The signs and symptoms, the cause, the risk factors, the nursing diagnosis, and the treatment. Yeah, thank you guys. Thank you for watching this video. I'm gonna put more video for you, but encourage me. Subscribe to my channel, click on the bell button, share my videos to your friend, to your family, to anybody if you like what I'm doing. This is Dr. Rene, #1 instructor. I know my content and I explain content. All my content. I don't give you any handout, just with no explanation. Thank you for watching this video. If you want more videos, if you want me to continue with this job, share and subscribe. Thank you. And the number again to call Dr. Rene is 561-2V19-4660. See you for another video. Thank you guys.